Hello, I'm Natalie Graves Tucker, and on behalf of AARP, I want to welcome you to this Caregiving Tele-Town Hall discussion on insights for navigating care between healthcare professionals and caregivers. Before we begin, if you would like to listen to this program in Spanish, press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione *y 0 en su teléfono ahora.
Today's discussion is about practical tips and resources to empower caregivers with the tools and knowledge to better navigate care between healthcare professionals and caregivers. We are connecting with thousands of AARP members from across the nation and will be joined shortly by thought leaders who will take your questions live. AARP, a nonprofit, nonpartisan organization with a membership, has been working to promote the health and well-being of older Americans for more than 60 years. And we are in your corner, fighting on issues that matter to you and your family. If you've participated in one of our Tele-Town halls before, you know this is similar to a radio talk show where you have the opportunity to ask questions and get answers from our guests. For those of you joining us on the phone, if you would like to ask a caregiving question, press *3 on your telephone to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. If you're joining on Facebook, you can post your question in the comments. If you are just joining, I'm Natalie Graves Tucker, and on behalf of AARP, I want to welcome you to this important caregiving discussion on insights for navigating care between healthcare professionals and caregivers. Thank you for joining us today and participating in this Tele-Town Hall. To ask your question, please press *3, and if you're joining on Facebook, you can post your question in the comments. So let's get started. Today, we're joined by two leaders in the field of caregiving. Laura Malloy is a project manager with the Caregiving and Health team at AARP, and Cassandra Vanez is a certified gerontological and advanced oncology nurse practitioner and fellow of American Heart Association and American Geriatric Society. Laura and Cassandra, so happy to have you both with us for this conversation.
Thank you so much for having us today.
Yes, it's great to be here. Thank you.
Family caregivers often rely on their loved ones' healthcare professionals for guidance and support. So today we'll provide practical tips and resources to empower individuals with the tools and knowledge to better navigate care between healthcare professionals and caregivers. To start, I think it's important to define what is a care partner and how does a care partner help? Cassandra?
Thank you, Natalie. A caregiver, which can also be referred to as a care partner, is defined as a person who provides a wide range of care to a chronically ill or impaired older family member, a partner, friend, or a neighbor. Some of those activities can include helping with day-to-day tasks, such as activities of daily living. We may refer to them as ADLs, that include bathing, eating, dressing, mobility, transferring, and toileting. Other activities are instrumental activities of daily living, or IADLs. These include meal preparation, food shopping, making phone calls and money management, transportation to appointments, or preparing medications. Another aspect of being a care partner involves care management. That includes finding the resources, navigating healthcare and social service systems, and serving as an advocate. There are also the invisible aspects of care, which are protective actions that ensure the older adult's safety and well-being without their knowledge.
Following up, Cassandra, how can caregivers benefit from being present during a loved one's routine medical visit?
Thank you. So whether it is a primary caregiver role or in some instances a secondary role that could be preparing medications on a weekly basis or simply bringing the partner and attending the appointment, knowing clearly the medication list, any additions or those to be removed is so important. Hearing firsthand from the provider team for treatments, tests, follow-ups that are needed, and finding out the reason they are needed. Many times we hear from the patient when we ask why a test is ordered, well, I don't know.
I am shaking my head because I am doing exactly this with my mother going to her appointment. So I get this. Cassandra, as a geriatric nurse practitioner, how has collaboration with family caregivers contributed to improving care? And what additional steps would you encourage caregivers to take to enhance the care experience?
What a wonderful question. To me, it helps with utilizing medications effectively. And that's not just prescription, but that could be over-the-counter medications also. So if you are the care partner that's responsible for medications, use a notebook to identify the medication brand name, a generic name, the dose, the frequency or how often it needs to be taken, and then the reason for taking the medication is helpful. The pharmacy gives a broad indication for the medication, but many times that may not be the reason that the provider team prescribed it. For example, many medications that are used to lower blood pressure can also be used to treat heart failure, to protect the kidneys in diabetes, and control the heart rate, and so on.
So what information is helpful for caregivers to know about in accessing their loved ones' medical records and talking to their doctor on their behalf? Laura?
There may be different consent forms required for each provider that you communicate with. If your loved one sees a primary care doctor and a cardiologist, they may require different forms for accessing information. If your loved one is hospitalized, that hospital will likely have their own consent form for accessing information. Once these forms are signed, they are usually scanned and kept on file and can be changed if necessary.
Cassandra, is there anything you would like to add to that?
Yes, thank you. Make sure that you as the care partner is listed on the HIPAA form, the short name for that. It's actually the Health Insurance Portability and Accountability Act form that protects any sharing of this protected health information, or PHI. Also, have the patient provide written consent that his or her information can be shared with you. It gives you the right to access the records, copy them, request corrections, and then also direct copies to third party, such as a consulting doctor.
Cassandra, what resources are available to help caregivers coordinate care and also manage the information they receive from various providers?
I am personally still a paper person, so I am so happy when care partners bring in notebooks or spiral binders, calendars that provide that information. This gives the care partner a chance to make notes, such as a daily weight, maybe blood sugar readings, or blood pressure readings. Bringing these notes to each visit will provide valuable information to the provider team.
We use a spiral notebook with all my mom's stuff, so it's good to hear you're a paper person. So thank you for that. We have a lot more content to cover, but first, listeners, let's get to some of your questions about in-home care. To ask your question, just press *3. Now I'd like to bring in Doug Tayek to help facilitate your calls. Welcome, Doug.
Hi, Natalie. Thanks for letting me be here.
Of course. Let's take our first question. Who do we have?
Perfect. Our first question actually comes from Facebook, and it comes from Aaron on Facebook, who asks, what specific support can caregivers provide during routine medical visits?
Thank you for that. Can you answer that for us, Laura?
Yeah, sure. So it is important for caregivers to be able to advocate for their loved ones during those medical appointments. And I always say that it's really important to do that because as a caregiver, you're primarily seeing your loved one a lot longer than that medical provider is. You're seeing them in the comfort of their own home, and you're noticing a lot of symptoms that they might be having or any emotions that they're expressing. So it's important to be able to share that information and kind of like Cassandra had just said, just taking those notes of any changes that you're noticing in behaviors, their weight changes, any changes in eating patterns or sleeping patterns, things like that are very important for the caregiver to be able to communicate with their provider.
Thank you for that. All right, Doug, do we have another question?
Question comes from Elaine in Pennsylvania.
Hello, Elaine. How are you? Welcome to the show. What is your question?
My question is, I'm looking to see how I could get paid to be a caregiver to my mother and my uncle, because my mother doesn't drive, and then my uncle still lives on his own, but he's going through chemo treatment, and I'm there for him, but I'm looking for a job, but I'm looking for a remote job because I can't work out of the house, because if something happens, I need to be here because I'm the only person they have.
Thank you for that, Elaine. Cassandra, can you offer her any advice?
I will give it a try. What a challenge, Elaine. I feel for everything that you're trying to juggle. Some states have passed family paid caregiver laws that would actually provide some monetary support for you as you provide caregiving to family members in your home. When it comes to services to support your family if you are not able to be there, the best way is to connect with some social services. Your loved ones' primary care physicians may have social work connections that may be able to provide some supportive services. And always there are respite opportunities available, and share that with the primary care team.
Thank you, Cassandra. All right, Doug, do we have another one?
Yeah, our next question comes from Jack in Oregon.
Hello there, Jack, out there in Oregon. What is your question?
Well, I'm disabled, and I depend on my wife to do a lot of things. And I was wondering, you could call her my caregiver, and I was wondering if there's anything that pays her for being my caregiver.
That is an excellent question. Laura?
Hi, thank you so much for your question. And depending on the state that you're in, there may be some benefits that your caregiver might be eligible for. I am going to, do you have a pen and paper available? I'm going to give you a number to call. So the number is 1-877-333-5885, and that is our AARP resource line. I will repeat that number one more time. 1-877-333-5885. And then I'm going to give you one more number, which is an elder care locator. That number is 800-677-1116. I will repeat that again. That is 800-677-1116. And when you call these numbers, let them know exactly what you're looking for and what your county and your state is, and they should be able to connect you with those resources.
Thank you to Cassandra and Laura for answering our callers' questions, and thank you, Doug, for fielding them all. We will get back to the phone lines in just a moment. Cassandra, what advice would you give to patients and caregivers about effectively communicating with their healthcare provider's office?
Wow, that is a challenge, and anyone that has tried to get through to get an answer to a question understands the challenges. Whatever the office is, make sure that you have a contact name. And for instance, I will just use an example of a nurse. So the cardiology practice has a nurse, Susie, who fields the calls. So have her name. Does she have a direct line? Are you being sent to a voicemail to leave a message? When can you expect to have your question answered? What about off hours? After the office is closed, how do you reach someone from the office? All of these questions are important to know the answer to when you are at your appointment itself. So make sure you get some clarification.
Thank you. Aside from messaging through online portals, what other methods can caregivers use to communicate with healthcare providers outside of regular office hours? What kind of responses or follow-up can they expect, Laura?
First, it is important to understand what the after-hours communication line can provide. If you get this number from your doctor or from their website, you might want to get an understanding of who is answering that phone call. Most lines are used for real-time advice from a healthcare provider, such as a nurse or a doctor, and can answer medical questions related to symptoms and medication management, such as a missed medication dose or pain management. Some after-hours lines are for appointment making and booking and billing information. This is typically noted. Another option is to leave a voicemail. Be sure to include who you are calling about, your name, and your relationship to the patient, and your phone number. Leave a brief, detailed message about why you are calling and a question or concern you have. Don't be afraid to call on the weekends or after hours for non-emergency needs. Follow-up responses might include a phone call back answering your question or encouraging you to schedule an appointment. That allots more time for the physician to address your needs.
Cassandra, is there anything you'd like to share?
Very good points, Laura. Thank you. Another thing I'd like to add related to that is the portal. Patient portals are a lot more in use these days. Are they utilized for prescription renewals? Does the pharmacy contact the office directly, or do you have to notify the office? And seek emergency services when they are indicated. Don't leave a message for something that is clearly an urgent message, such as chest pain or difficulty breathing or signs and symptoms of a stroke.
Thank you. Cassandra, what specific types of information should caregivers have ready to discuss with their loved ones' healthcare providers?
Back to our notebook, right, Natalie?
Yep.
So activity level is so important. And also, how is your loved one's appetite? These can tell us a lot about the symptoms of quality of life. So these are very important. And sometimes it needs to be written down. Recording the symptoms, like I talked about with shortness of breath, nausea, diarrhea, things that are important to take note of, to share with the provider team, and also can be shared on a phone call if you're leaving a message on a voicemail. When did it start? How long does it last? Is there anything that makes it worse? Or have you tried anything that makes it better? What were you doing when these symptoms started? And were there any other symptoms associated with it, such as dizziness, sweatiness, or your heart palpitations, or episodes of dizziness?
Really good tips, Cassandra. Now, Laura, how can caregivers lean on healthcare providers to assist caregivers in having difficult yet honest conversations with their loved ones about their care?
It is important to make sure you and your loved one are on the same page in understanding what is going on medically and how this is impacting their daily activities. During appointments, try and encourage your loved one to ask questions and share their concerns if they are able to do so. Sensitive topics such as driving can feel uncomfortable to start, and the severity of the conversation varies person to person. Ask your provider what options we can explore to make the situation safer and easier for your loved one. Whether it is driving, personal hygiene, or accepting help from others, your provider can help you determine how to approach these conversations and what steps and alternative options are worth discussing with you and your loved one.
Cassandra, your thoughts?
One of the most difficult decisions that I have ever had to do as a geriatric nurse practitioner is to help a family navigate when a loved one should no longer be driving. Obtaining objective information is so important. It's not an opinion that you think they should stop driving. One of the resources that is available is the American Occupational Therapy Association. Can provide a test of driving skills. AAA offers a road-wise driver course, or AARP also has a smart driver course. These remove that subjective opinions of families, and that can help facilitate healthy discussions when it is time to stop driving.
Thank you both for these very helpful tips. I want to take a couple minutes and bring in Megan O'Reilly, who's Vice President at AARP, for a quick update on how AARP is fighting for family caregivers. Welcome, Megan.
Happy to be here.
Supporting caregivers is a top priority for AARP. So can you share how advocacy plays a part in that?
Sure. Advocacy is a path for change, and every day AARP shows up at the federal and state levels fighting for better support and protections for caregivers and their loved ones. Family caregivers are the backbone of care in this country, and we press for ways to lessen the physical, emotional, and financial challenges they face.
Can you share a bit more about the financial burden?
Sure. There's a huge economic toll with caregiving. An AARP report shows that family caregivers provide an estimated 36 billion hours of care each year for loved ones, and that value of unpaid care is $600 billion a year. And this doesn't include the direct financial costs, such as the thousands of dollars spent out of pocket by people generously providing care or for the lost wages they may face. Caregivers need and deserve more assistance from city, state, and federal governments.
What kind of help are you fighting for?
We are urging federal and state governments to take action and pass legislation that helps family caregivers. We need legislators to enact family caregiver tax credits and for workplaces to adopt family-friendly policies. We're also fighting to protect Medicare and Social Security benefits because the stronger those benefits are, the more we can relieve the burden on caregivers and keep older Americans healthy. We want every American to have the full range of care that they need.
Absolutely. Megan, if listeners want to help out or stay on top of advocacy news, how can they do that?
We would encourage everyone to join the fight, become an advocate or a volunteer. Call your AARP state office or go online to aarp.org/get involved and sign up for our free advocacy newsletter.
Wonderful. Thank you for joining us today, Megan.
Thank you.
We will get back to the phone lines in just a moment to answer more of your questions. Please press *3 on your telephone keypad now or anytime during the call to be connected with AARP's staff. Cassandra, in what ways can healthcare providers support caregivers in monitoring their loved one's symptoms and ensuring their safety, whether the condition is short-term or long-term?
So like I was sharing before, being very specific about signs and symptoms that they're observing and keeping track between appointments. It's so much more valuable to me when I have multiple blood pressure readings than just the one in the office to make decisions about medicines. Also, keep track of any of the side effects of a new medication. What should you look for? Should you be monitoring blood sugar levels? How often should you take blood pressures? Should you keep track of daily weight? And then any changes, like when should I call you when what the blood pressure reading is, or schedule a follow-up appointment.
Laura and Cassandra, this next section really hits close to home for me. What are some key considerations when caring for a person with dementia, and how can healthcare providers help coordinate care for loved ones living with dementia?
It is important to share the symptoms and changes you are observing with your loved one. Every person with dementia has a different experience and requires a personalized care plan specific to their needs. For example, if you are taking care of your loved one in the home and notice they are more confused and are trying to leave the home at random times of the day or night, it is important to communicate this with your provider to determine if this warrants a medical intervention through medication management, or if there are other support options in the community to link you to, such as home care or installing alarms or alerts.
And to me, safety is a paramount concern. At early stages, may require preparing for potential challenges that are coming. Mm-hmm. Cooking is often the first concern for safety and decision making, such as forgetting how to use household appliances can occur. Use appliances that have an automatic shutoff feature. Applying stove knob covers. Removing the knobs or turning off the gas when a stove is no longer in use can prevent some unsafe usage. Disconnect the garbage disposal. Discard toxic plants and decorative fruits that may be mistaken for real food. Remove vitamins, prescription drugs, sugar substitutes, and seasonings from the kitchen table and counters to begin with.
Cassandra, when caregivers observe symptoms at home that their loved one doesn't show during visits, how should they communicate these concerns with the healthcare provider?
One of the things that I see often discounted by families and patients is a fall. A fall is not a normal part of aging, and it should never be discounted and always be evaluated by the medical team. A fall can be an early indication of a clinical event, such as an irregular heart rhythm, an electrolyte imbalance, infection, low blood pressure, or dehydration.
How does the responsibility of caregiving affect the overall well-being of caregivers from your perspective as a nurse practitioner, Cassandra?
Oh, there are numerous documented consequences for the physical and emotional health of caregivers. For example, according to the U.S. Health and Human Services Office of Women's Health, caregivers of chronically ill spouses have a 63% higher chance of dying. Extreme stress in caregiving can take 10 years off a caregiver's life. The stress of caring for an older adult with dementia continues to affect the caregiver's immune system for up to 3 years after caregiving ends. Caregiving spouses who provide more than 36 hours a week are 6 times more likely to experience depression or anxiety. And finally, family caregivers are twice as likely to suffer from chronic conditions as non-caregivers are.
Cassandra, why is it essential for caregivers to maintain a relationship with their own primary health care provider?
It is so important not to lose sight of your own health needs. Don't delay preventative tests or screening visits, such as mammograms or lab work. Self-reflect on the strain of being a caregiver and discuss with your provider what you are feeling.
Great. Thank you, Cassandra. Doug, let's take a call.
Great. Our next call is, or I should say our first of our next round of calls is Kay in Florida.
Hi, Kay out there in Florida. What is your question?
My question was about hospice when they become involved as a caregiver and contacting hospice, and then they give additional medications we may not be aware are going to happen.
Thank you for your question. Cassandra?
So, thank you for that call, Kay. One of the things that happens when hospice is consulted, the hospice pharmacy and the hospice provider takes over all of the medication prescriptions. So the primary care team that you previously had are not in charge of the medicines. Now, anytime new medicines are prescribed, whether it is hospice or by a provider or a consultant, you should know why this medicine is prescribed and when you should give it and when you should not give it. So please be very clear and don't hesitate to ask questions.
Thank you. Doug, do we have another question out there?
Yes, our next question comes from Ethel in Colorado.
Hi, Ethel in Colorado. Welcome to our show. What is your question?
Hi. Well, I'm calling concerning my son. He is bipolar, and I'm his caregiver, and calling about scamming. He has, how do I keep him from being a victim of these scams? He's already been scammed one time, and we thought he had learned his lesson, and now he's just a couple of days ago he's caught up in this other scam. He swears that the FBI or somebody, the government, is going to give him $11 million if he only pays this $400-some, which he paid to them already, and now they're trying to get him to borrow $20,000 to get a lawyer. He says, I tried to explain to him that no one, if you're going to win money or have money, they're going to not ask for money up front. And he doesn't understand that, and he's just.
Thank you for that. That is very challenging. So, Laura, can you help her with any tips?
Yes, thank you for your question, Ethel, and I'm so sorry that you are going through this. AARP actually has a lot of resources that go over fraud and scam, and there's a lot of different elements that we really need to consider when it comes to preventing scams and being safe. And not to overwhelm you with our website, you can go to our website and at aarp.org and look at our fraud content. But I recommend starting by calling our helpline, and you will be connected to a caller that is trained to give education on preventing further scams. And you can tell them your situation, and they could walk you through different things that you and your son can consider to stay safe. So that number is 877-908-3888. 877-908-3360. Again, that is 877-908-3360. And they operate Monday through Friday, 8 a.m. to 8 p.m. And they will absolutely be able to give you some valuable resources.
Thank you, Laura. Good luck to you, Ethel, out there. Doug, do we have another question?
Yes, and this one actually comes from social media and one of our viewers on Facebook. This is Lisa, and her question is, what specific challenges do caregivers often face when caring for someone with dementia, and how can providers address these challenges?
Thank you for your question, Lisa, on Facebook. Cassandra, can you help answer that one?
Yes, thank you, Lisa, for that question. So when we talk about dementia, Alzheimer's, or other sorts of cognitive impairment, thinking about whether it is very early stages of the cognitive impairment. And those are the things that I talked about related to safety. One of the challenges that we do understand that dementia is a terminal illness. There is no cure. And sometimes needing to understand as a family that things will get worse. When your loved one is having difficulty in getting to the bathroom, needing help with dressing, needing help with eating, those are challenges that become very stressful to the caregiver team. Also, that can be complicated by emotional outbursts, even violence by the loved one. So it's important to share with your provider team some of these things that you are observing. And when difficulties with these activities of daily living occur, maybe thoughts about respite care or maybe getting some additional assistance in the home would be the best strategy.
Such great questions from our callers. Thank you both for responding to them, and thank you, Doug. Laura and Cassandra, how can caregivers and healthcare providers work together to identify early signs of stress and burnout? What practical strategies would you suggest helping them manage or prevent burnout?
It is important for caregivers to stay in tune with their own needs, such as their mental health, physical health, and other social needs. Caregivers should consider how well they are able to keep up with their own routine health appointments. Oftentimes, caregivers are so overwhelmed with the logistics of scheduling appointments or finding information for their loved one that they put their own needs on the back burner. You can talk to your own healthcare provider or your loved one's healthcare provider, such as a doctor, nurse, or social worker, and let them know that you're going through this. And they can help you manage these needs and determine areas that you can seek additional support.
Great advice. Some other things that you can start to consider as a caregiver is, are you worrying all the time and feeling burdened? What about fatigue? Are you tired often? Maybe you're sleeping too much or not enough. Gaining or losing weight could be a sign of burnout. What about irritability? Do you easily lose your patience and become angry? Are you losing interest in activities that you used to enjoy? Feeling sad? Maybe having frequent headaches or other pains or health problems? A sign of burnout could be misusing alcohol or drugs or even prescription medications. Like we talked about, missing your own medical appointments. What you can do, focus on that. Ask for help and then accept the help. Set some goals that you can reach. Break these large tasks down into smaller steps so you can do one at a time, such as housekeeping responsibilities. Make lists of what's most important, so set those priorities and follow a daily routine. That's going to help you and your loved one. Say no to requests that are draining, and this is the worst time of year. We need to say no to hosting meals for holidays or other occasions if it's too much. But one thing you can do is get connected. Learn about the caregiving resources in your area. Join a support group and seek that social support. You are not alone. Stay connected to family or friends that can support you, and make time each week to visit with someone, even if it's just a short walk or a cup of coffee. And take care of your health. Find ways to sleep better. Move more on most days. Eat a healthy diet. Drink plenty of water. And see your healthcare professional. Get the vaccines you need and your regular health screenings. Tell your healthcare professional that you are a caregiver and talk about the worries and symptoms that you are experiencing.
Cassandra, I feel like you're talking directly to me, so thank you for those great tips. Laura, would you like to add anything?
Yes. For those tuning in on Facebook, we're excited to share that we have a wonderful private Facebook group available right here on the platform. You can easily find this group on Facebook by typing in the group name called AARP Family Caregivers Discussion Group. Again, that is AARP Family Caregivers Discussion Group.
All right. Let's get back to our listeners' questions. Doug, who do we have on the line now?
So our first question actually comes from somebody who had to hang up, but we're hoping you could still answer their question. And it was from Jack in Oregon. His question was sort of something that was talked about a little bit earlier, but it's, are there any programs for my wife to get paid as my caregiver?
Thank you for that question, Jack in Oregon. Laura, can you take that one?
Yes, thank you for your question, Jack. So it depends on where every state has different resources that your caregiver might be eligible for. So I highly recommend you starting off with our Elder Care Locator line, and that phone number is 800-677-1116. Again, that is 800-677-1116. And that number can connect you to local resources such as the Department of Social Services that can go over eligibility programs for your caregiver, and also home care resources and other care needs. The other line is our AARP resource line, and that number is 1-877-333-5885. Again, that is 1-877-333-5885. And through that number, you can get resources such as your local AARP resource guides and other resources that you might be eligible for.
All right. Thank you for that. All right, Doug, do we have another question?
Sure. So our next question is actually a social media question, and it's from Sandy, who asked about she's older and rescues animals, and she needs help sometimes around the house, and is looking to have somebody support her who doesn't mind being around animals, and she wants to know, is there a resource, or how can she find that person who can serve as her caregiver but also is okay with animals?
Thank you for your question out there. Laura, can you?
Sure. Thank you so much for your question. And there might be a lot of different opportunities locally to you, stemming from your senior center to volunteers. And there even might be home care agencies that are comfortable with being around animals. I'm going to repeat the elder care locator line again for you, and then a couple of other tips for you. So the elder care locator line is 800-677-1116. Again, that is 800-677-1116. And I also highly recommend you call your senior center that's local to you and explain to them your situation and what you're looking for as far as care. And usually a lot of our senior centers locally are staffed with professionals like a social worker like myself or a care manager.
Thank you. Doug, do we have another question?
We do, and this one is, again, the social media question. It's Steve on YouTube, who's watching us there, who asked, what specific strategies can caregivers implement to manage stress and maintain their well-being?
Thank you, Steve, for listening to us on YouTube. Cassandra, can you address Steve's question?
Yes, Steve. So starting with a healthy lifestyle, I think is the most important thing. Making sure that you maintain a healthy diet and get enough sleep to help you manage that stress. What works? Maybe mindfulness meditation, maybe walking, listening to music. But remember, Medicare will cover some respite time if you need it. And that is to provide care to your loved one while you have some time to yourself. So talk to the primary care team about your needs.
Thank you. Doug, who's our next question?
Sure. And this one, again, is on social media from Facebook, and it's Terry who writes, how can healthcare professionals better support caregivers to address their physical and mental health needs?
Thank you, Terry. Laura?
Thank you, Terry, for your question. Healthcare professionals can support family caregivers addressing their physical and mental health needs for their caregiving role by, for example, for the physical needs, sometimes our caregivers can strain their backs or other areas of their body while they're trying to help their loved one physically. And sometimes when we talk to our healthcare providers, they can give us tips on how to better transfer our loved one. We might be having our posture in a different way that it shouldn't be, or we might be using medical equipment such as a walker or wheelchair improperly, and they could walk us through steps on how to better utilize medical equipment. And as far as mental health needs, again, it's, caregivers can get overwhelmed and stressed out very easily. And it's important to let our providers know that we might be overwhelmed. That way they can help intervene and give us resources that might be able to ease some of that burden.
Thank you. Doug, do we have another question?
Sure. Kevin sent this one to us, and he writes, what specific health concerns should caregivers discuss with their primary healthcare provider to ensure they are adequately supported?
Thank you, Kevin, for your question. Cassandra?
Yeah, thank you, Kevin. Sometimes anxiety and stress can appear in physical symptoms. If the caregiver is suffering from headaches, nausea, palpitations, feeling the heart racing, stomach discomfort, heartburn, those things could be a physical problem, but also could be a part of the stress and the caregiver burden. So don't discount any physical symptoms that you may be feeling, and follow up with your provider to make sure that you are available to care for your loved one.
Thank you. To ask your question, please press *3, and if you're joining on Facebook, you can post your question in the comments. Are there any more questions out there for us, Doug?
Sure. We have one from Anne who writes, how can healthcare providers assist caregivers in developing a safety plan for their loved ones?
Laura, thank you, Anne.
Thank you, Anne. Yes, our healthcare providers can definitely help us develop safety plans for an array of situations. So whether you're a long-distance caregiver and you're trying to help your loved one from a long distance in another state, they can go through steps on what to consider to keep your loved one safe and stay on top of that. There's also disaster planning, whether you live in a state where you might be susceptible to hurricanes or other natural disasters. And if your loved one has a chronic health condition such as diabetes, or if your loved one also has dementia, there's also safety plans that are specific to those needs. So I highly recommend you relay your concerns to your healthcare provider and discuss having an emergency plan. I think that is important for everyone, regardless of where you live and what your situation is. It's a lot easier to plan when nothing is happening as opposed to planning when you're in crisis.
Thank you all for your questions. It's all been great advice, and I want to thank Laura and Cassandra for helping bring more awareness to this incredibly complex issue that faces so many. I am not alone. You're already giving us some great tips, but before we wrap up, I wanted to ask if anyone has any final thoughts to share with our audience. Cassandra, let's start with you.
Thank you so much for this opportunity to have this conversation and make sure that we are taking care of those that care for our loved ones. Remember, this holiday season, it can be stressful enough, so please say no if you need to, and do not feel guilty for caring for yourself.
Great advice. Thank you, Cassandra. Laura?
It is important for AARP to continue to provide resources and content to support caregivers like those listening today. Please continue to visit our website at aarp.org/caregiving to keep up with our new content and resources.
Listeners, thanks so much for joining us for this discussion on navigating care between healthcare professionals and caregivers. We hoped you learned something new today. For more information and resources for caregivers and their families, we encourage you to visit aarp.org/caregiving. That's aarp.org/caregiving. Thank you to everyone and have a fantastic day. This concludes our call.